Hello, I'm Beth Reilersdam, known as Curvy Girl Beth across socials, and I'm here today to advocate for weight loss medications for those with Medicare and Medicaid coverage. I myself have accessed the medication Zepbound, which is tirzepatide, since May of last year, and it has been miraculous for me. Within the first 18 hours, I experienced a decrease in swelling in my legs. I have a condition called lipedema, and that causes an additional layer of adipose tissue from the waist down and in the upper arms. It causes swelling, pain, and a myriad of other things, but I was really looking to this medication to help me reduce my inflammation because my legs were becoming swollen enough to be at risk for developing lymphedema. I have in my lifetime been various sizes and really have fought either overweight or obesity my entire life. So I've been on a weight management journey since the beginning of time in my lifetime. And what I have experienced since utilizing this medication is that it has enabled me to release an additional, at a minimum of 45 pounds since last May of inflammation. With that, what I've experienced is a lightness of being, a relief, I am less sensitive to allergens. I have a lot of food allergies and other conditions that really this medication has helped improve tremendously. I also have had some improvement in my sleep apnea, which recently the medication was noted for having a benefit toward, and I can agree to that. I believe that this medication is a necessity. Now that we know that obesity is a disease and not just a lack of willpower, I believe that this medication can help everyone that is struggling with obesity in any way. It does help people with the reported food noise. It does help with that as well. And I know that for some people that really has been very beneficial. I happen to be someone who really has prioritized protein for a good majority of my life. And so in this process, I have entered that same thing. And in my opinion, when you prioritize protein in conjunction with this medication, you have even better results. I believe that those who need access should have access. And we know that in the United States, there's more than 50% of the population falls into these overweight and obese categories. And so the access should be there. It should not be because someone's insurance plan just happens to not exclude it. It should be because it is included as a necessity in order to treat this type of disease. I just realized that I am currently the same weight I was decades and decades ago when I went on my first medical diet program that was supervised for 6 months through a medical institution. And I'm realizing what would it have been like had I been able to have this type of medication then, and what a different life I would have had as opposed to becoming someone who grew to 404 pounds as a result of trying to diet my obesity away, and having to have a Roux-en-Y gastric bypass in 2003. I was very successful. I did let go of 230 pounds during the first 18 months, and I did manage to keep that off for about 14 years, about at least 90% of that. But the second that I was diagnosed with lipedema that I spoke of, I thought I had a reason why my body was the way that it was. And I switched up my eating plans, my disciplines, and to my detriment, I found myself in a situation where I had regain. And now that's what I've been working on with this past year. But with that regain came several conditions that wouldn't have been there had there not been that regain. And perhaps had I had this medication, I would have been able to keep a steady, a steadier situation, because the medication would have helped keep that at bay. Like, really need your help today to tell your story and reach out to Medicare to let them know that accessibility to these weight loss medications should be for everyone. And you'd like to let them know that all Medicare and Medicaid covered individuals should be able to access full spectrum obesity care so that they can manage their weight and improve their health, just like I have been able to improve mine. Thank you, and I look forward to hearing how it went for you. Make sure you note in the comments that you sent it